Good evening, all. Once again, welcome to Light It Red podcast series, a joint initiative by Natco and Voice of Healthcare Team. Light It Red, a podcast platform dedicated to spreading awareness, sharing stories, and bringing hope who have been impacted by blood cancer. You all know every year millions of people around the world and in India also quite often diagnosed with conditions like leukemia, lymphoma, and myeloma. Yet too often signs and symptoms are ignored, so unnoticed today. So today we have Dr. Satya Prasad, renowned Haemato-Oncologist and BMT physician, bone marrow transplant physician from Apollo Hospital, Chennai. He's with us to understand and explore what actually blood cancer means, and also he's with us in the entire half an hour journey to share his knowledge on diagnosis, treatment, and other aspects of blood cancer. As we explore our how multidisciplinary care and clinical research is shaping in the future of blood cancer, is honored to welcome you, sir, once again to the Lighted Red platform. Good evening, sir.
Good evening. Thank you very much. That's a very generous introduction and a very great initiative by Natco, especially when it comes to malignancies, where there's always a gap, especially in our country, where diagnosis or recognizing symptoms and going to the right hospital and the right time is very, very important, especially when it comes to malignancies, not just blood malignancies, any malignancy, in fact, to say. So let's go ahead and we'll explore what all we can share together and see how we can help patients to help with the treatment.
Thanks once again for your valuable time. So when we talk about this, first we come to the basics, sir. Actually, our audience want to know what is blood cancer and how it is differ from other forms of cancer.
Blood cancer is a group of cancers that generally originate in the bone marrow or cells of the blood, including the immune system. These are not like solid organ malignancies where they start in the lung or in the breast or in the thyroid, but they start in the bone marrow cells and the lymph nodes, affecting the function of these cells. For example, we have three types of blood cells, that is red blood cells, which help in carrying hemoglobin to the various organs, and white blood cells, which are a very important part of the immunity, and platelets, which help to stop bleeding when we get injured. So blood cancers are those cancers which affect the function of these cells. In the broader aspect, if I have to say that, they generally don't present as lumps. Of course, we see lumps in a few sorts of blood cancers, but generally in blood cancers, we see the function of these primary blood cells getting affected. What makes these blood cancers unique is that they, as I already told you, they generally don't form lumps or tumors. Instead, they disrupt the normal blood cell function, leading to very common symptoms like anemia. Patient don't come and tell you that I have a blood cancer. The patient comes and tells you with a feeling that, sir, I've been anemic for a long time. Doctor has been giving iron injections and tablets, but still my hemoglobin is not improving. That is the common symptom which we generally see when we see adults coming with low hemoglobin. We explore and do certain investigations and we see them having a blood malignancy. So sometimes patients will come with recurrent infections. Some patients will only present with bleeding. So these are the unique symptoms which we should suspect which we should look for when we are suspecting blood cancer. Treatment also differs since therapies often target these circulating or bone marrow based cells, unlike solid organ malignancies where we go ahead and do surgeries to remove these tumors.
Okay, sir. Thanks for giving the brief. But sir, generally, when you talk about the risk, who are at risk for developing this type of blood cancer, sir?
This is a very common question which I get. Why did I get this blood cancer? What did I do to get these blood cancers? So it's we cannot say who are actually at risk of developing blood cancer. Anyone can develop blood cancers. But there are a few well-identified risks for blood cancers, like genetic predisposition. Suppose someone has blood malignancies in the family, they carry certain genes, so they are prone for blood cancers. Or people who are working in environmental, certain environments like occupational, which deals with benzene industries, or radiation industries or chemical or pesticide industries. Those can also those patients are also prone for blood cancers, and certain viral infections, especially HIV, which is very common in India, and Epstein-Barr viruses, which is also quite common, can predispose to blood malignancies. Also, patients who have undergone solid organ malignancies, transplants for organ failure, for example, liver transplant or kidney transplant, who will be put on long-term immunosuppression. So people who are immunosuppressed for very long time are also prone for blood malignancies. So these are the very identified common risks for blood malignancies. Having said that, any person can develop blood malignancy, but best thing is to have broader aspect to check whether the particular person is suffering with blood cancer or not is very, very important. We should have that in mind when we are diagnosing or treating, trying to explore blood cancers.
Thank you, sir, for elaborating the risk. But what age, sir? Because children are also getting affected nowadays. So what is the particular age? Any age standardization is there, sir?
There's no particular age standardization. Even young infants can develop blood malignancies, and very elderly people can also develop blood malignancies. It's a widespread range of age, but certain type of blood malignancies can present in elderly age groups. For example, myelomas generally we see in elderly age groups. So certain type of malignancies can be suspected in elderly age groups. Certain type of malignancies can be suspected in younger age group. For example, leukemias can be seen in from children most commonly and can be seen in adults also. Myelomas generally seen in the elderly population. Lymphomas also can present in the middle-aged to elderly population. So based on the type of malignancies, blood cancers present at various stages of life, and all ages are susceptible for malignancies. But the age of diagnosis, initially blood malignancies we used to be diagnosed at a later age group, but now malignancies are being identified quite earlier because of a lot of literature which is freely available, and people are quite aware about the symptoms. So the age at which we are diagnosing the malignancies is quite becoming younger and younger population. Even we see blood malignancies, but any age is predisposed to for blood malignancies.
Okay. So these were the basics, sir. But to understand the burden, what are the trends or the incidences of blood cancer, sir, in India now, till today?
In India, the trends which we are seeing with blood cancers actually are, in fact, concerning, and we can also actionable. Over the past several years, there has been an increase in the incidence of blood cancers like leukemias, lymphomas, and myelomas. The rise is partly due to better diagnostic capabilities which we have, especially in the second tier and third tier cities also. Even if the diagnostics are not available at that center, people and physicians are sending blood samples to other higher cities such that the diagnosis can be made. So what I see is, because of these environmental factors, lifestyle changes, and possibly these genetic influences, which we are still studying, the trends which we are seeing is younger people are also getting diagnosed earlier, and not just waiting for the symptoms to mature or complications to develop. That's what I actually see it. The trend is coming more and more. We are able to diagnose because of the better diagnostic availability which we have.
Okay. And when we talk about diagnosis part also, sir, is that early detection is so crucial for blood cancer, sir?
Yes. Early detection is very, very crucial in blood cancers, because it significantly increases the chances of successful treatment and better outcomes. Why? Because suppose if a blood cancer patient comes at a very late stage, patient would have already developed complications, and most of these patients will be needing high dose chemotherapies. If the patients come with in a very late stage, we have to address the complications rather than giving the treatment for the blood cancer in the first aspect. So diagnosing blood cancers in earlier stages, as soon as the symptoms develop, will have extreme impact on the treatment and the long-term outcomes. So and also we can also prevent the complications if we diagnose earlier rather than waiting for the complications to develop. So early detection definitely has a very good impact on improving the survival outcomes and reducing the intensity of the treatment, and also duration of the treatments needed.
Okay. And when we talk about signs and symptoms, sir, what kind of signs and symptoms never been ignored? Is there any
People
particular signs?
Particular signs and symptoms are seen. Blood cancers are not a very straightforward diagnosis to say. They generally mimic common illnesses. For example, patients will have low hemoglobin. So when they go to a first for a physician will generally not suspect a blood cancer. Even if he has a blood cancer, first blood cancer will not be the first thought in a physician's mind. So identifying these subtle and these common illnesses at the primary stage itself is very, very important when it comes to detecting these diagnoses. Also, someone who has swollen lymph nodes which are painless, which are not going with antibiotics or some, then they should definitely approach to a hematologist saying that, sir, I have these lymph nodes which are not going away. We've used a lot of antibiotics, but still. So that is not something which is an infection causing lymph node. It is something else. So it should be explored in that. Some people can have excessive sweating, that their clothes will be drenched. Some people will have unexplained weight loss. Some will present with shortness of breath. Some patients may present with only with bleeding under the skin or bleeding from the gums. So these are the subtle symptoms or signs which we generally patients should identify. And if they are not going away with the primary treatment or whatever treatment they are receiving locally, they should definitely approach to higher centers to rule out these disorders.
Yes, sir. During our earlier, when we are talking about, you already mentioned family history, genes, mutants, if they carry.
Yeah.
So for those, for example, for those patients set of family was already carrying genes, is for. So what kind of screening recommendations are there for?
Yeah. So there are no set screening tools for diagnosing blood cancer. For people, for example, people with a family history of blood cancer, screening and early monitoring becomes very, very important. But having said that, we don't have universal screening tests that if your father has a blood cancer, you do these tests annually. Not like that. But we will ask them to be more vigilant. We will ask them to get annual health checks done, to be in touch with the doctors, and they should also inform their family health physicians that my father is so and so, he has or my mother so and so, or my close relative so and so, such that we will be able to do genetic counseling and genetic testing for the patients also, or the person who is coming to your clinic, such that he will be well aware of the symptoms that he should not miss if he develops in near future. So these are the key things which we tell them to be aware and have regular annual health checks and be in touch with their physicians, have their family physician informed, such that they will be quite aware when they develop the disease at a later stage. Also, they'll be much aware that okay, this might be this. It could not be simple anemia, something like that.
Sir, treatment part, if you see, how has this treatment landscape been evolved for this blood cancers last 10 years?
Yes, sir. The treatment part of the blood cancer is actually very exciting, especially in the last few decades. From 2000 onwards, treatment for blood cancers is extremely, I'll say, very exciting, because it has dramatically progressed very well. We have moved just beyond chemotherapy or radiotherapy into personalized medicine, targeted therapies, where we can exactly zero in that particular genetic mutation which caused this cancer, and we hit that mutation. For example, chronic myeloid leukemia. It is a blood cancer. Before 2000, chronic myeloid leukemia is a very, very aggressive blood cancer where most of the patients needed bone marrow transplant and high dose chemotherapies, and most people did not survive. But in 2000, we have a revolutionary molecule called imatinib, which are tyrosine kinase inhibitors, where more drugs have come in the same group. These drugs have changed this aggressive blood cancer into a simple disease like diabetes, where they just take this pill daily, and they have a normal life expectancy. That is for CML, I'm saying. But there are other newer drugs like immunotherapies, CAR T cell therapies, where we pull out immune cells from the patient and we re-engineer them in a lab and give them back to the patient, such that they don't particularly target these particular cancer cells and bringing down these blood cancers, especially in aggressive leukemias and lymphomas where they don't respond to standard chemotherapies which we give. Also in India, the awareness and access to these advanced treatments is growing day by day, especially because of the literature which is easily available around and internet. So what I see is a very bright future in the near coming days when it coming to the treatment of blood cancers. In fact, we see a lot of news coming out also. Each day a new molecule has been approved. It's all very exciting when it comes to the treatment of these blood cancer.
Okay. Sir, uh, could it be this bone marrow transplantation also? Our people want to know, public want to know what is actually this BMT and when does they give this BMT?
Bone marrow transplant is also called as stem cell transplant. It is a very says simple. It is a complex procedure where I told you that blood is produced from the stem cells which we have in our bones. Okay, that is called bone marrow. So in these blood cancers, we replace the patient's cancerous bone marrow with a normal bone marrow from either with the help of stem cells called donor stem cells. We have two types of transplants. One is autologous stem cell transplant. The other is allogenic stem cell transplant. Autologous stem cell transplant means we take the patient's own stem cells and we clean the patient's bone marrow completely such that he's free of cancer cells, and we'll give these stem cells back to the patient. That is autologous stem cell transplant. Means it replaces a diseased or a damaged bone marrow with a healthy bone marrow. Similarly, we have an allogenic stem cell transplant where we get the donor cells from donors, especially either they might be related donors like siblings or an unrelated donors, where we have banks, we have donor blood banks also, where we get donor cells from there. After eradicating all the stem cells from the patient, it's just like putting new seeds, and such that his normal hemoglobin, WBC, and platelets will start improving. So this is also a curative procedure for most blood cancers. Of course, not all blood cancers need bone marrow transplant. There are certain cancers which need a transplant. Some cancers will not need bone marrow transplant.
Okay, sir. It's very clear. So many treatment options are available, and so much has been evolved in treating blood cancers. So, but still, sir, we are in India. So still, the point comes. You also know affordability and how accessibility and affordability. When we talk about affordability, sir, how far these treatments are affordable? Is there any schemes? Can you please?
Actually, this is a very complex and very important issue when it comes to treatment of blood cancers, because all these blood cancer treatments are quite expensive, and the access to these high-end treatments, especially, it's very, very limited in India, where very few centers do it. For example, CAR T cell therapies, which is also a part of treatment for many blood cancers, is not available in many centers. That is one thing. The other thing is affordability, as you asked. They are very, very expensive. Of course, there are government sponsored programs where certain institutes like AIMS and all do it. But most of the people will not be able to go to these centers because of the limit of the number of patients that they take. The government should come up with such plans where these expensive drugs are affordable, and because all these drugs are actually like magic molecules, they help really cure. They are really curative in terms of when it comes to the treatment of these blood cancers. So we should. I think we should train more and more hematologists and oncologists also to get access to these treatments and somehow bring down the cost. For example, CAR T cell therapies, which was available abroad earlier. Now we made our own CAR T cells, where Nexcar 19, where Tata, Mumbai, and IIT Bombay together, they did the molecule Nexcar 19, where the cost of drugs has come down, but still the affordability is still there, because the cost of these drugs runs into lakhs, where not everyone can afford these drugs. I think government should come up with some plans or something such that it is accessible to everyone. As of now, I don't think we have any such things where a lot of government schemes are available for all these newer drugs. Even some insurance companies also don't cover some molecules, or citing out reasons saying that this is immunotherapies we don't cover and all. I think government regulations should change such that these drugs are accessible and covered under insurance, something like that.
Sir, anyways, this targeted therapy is affordable, no, sir? You were discussing about earlier about this. Targeted therapy is also there.
Targeted
That
therapy
is
means
affordable.
same target therapy is we'll target one particular cell. For example, cancer cells will have certain markers. So we identify such marker and we put on this target molecule such that this particular molecule will go attack those cancer cells particularly. So these are called targeted molecules. For example, the other targeted agents are we identify certain genetic mutations. For example, FLT3 enable. So we particularly have molecule for that particular mutations, such that the gene driving these cancers will be going down, and the patient will be cured of these cancers. All these are very specialized, as I said, like personalizing each
Yeah,
patient.
personalized.
Yeah.
That is what, sir, that we got understood. But is it affordable, sir? Targeted therapy? Is there any glitches in this?
No, targeted therapies depends on what targeted molecule we are talking about. Of course, most of the companies have come up with even with these targeted molecule also they come with patient support program, and which target therapies is being quite commonly used in all the centers. Once
Yes.
they particularly have the target that particular genetic mutation or something, and a lot of companies are coming up with patient support programs. So the accessibility to these targeted therapy has grown in India very much in the last few years.
So, anyways, we are talking about accessibility of even the diagnostic part and diagnostic and therapies, whatever we say. How, for tier 1 and tier 2 cities who travel along.
Hmm.
So how advanced diagnostics and therapies are accessible to this kind of cities where they are traveling, sir?
So, see, almost all metropolitan cities like Mumbai, Delhi, Bangalore, Hyderabad, Chennai, all these centers
Right.
definitely have all these advanced diagnostics and therapies. But Tier 2 and Tier 3 cities are also slowly growing up. One important thing is diagnosis is very important when it comes to blood cancers, which because of these labs which have come up in a great way in Tier 2, Tier 3 cities, they try to send the samples and get the report. But when it comes to Tier 3 cities, patient from a Tier 3 city trying to get treatment, they might be at a bit disadvantage when it comes to especially accessing these high-end treatments. But in India, the oncology has grown so much that just because someone is in a Tier 3 city is not in a position these days that he's not able to get access to these treatments. Most of them get access to these treatments because when it comes to treatment of cancers, people cross continents and go. So I don't think any more the Tier 1, Tier 2 cities do change when it comes to the treatment. What in the primary healthcare level and all, I think there is a lot of gap when it comes to diagnosis. So when a patient is coming from a Tier 2 or a Tier 3 city to a Tier 1 city, what I always say is better to have a good communication between the two centers of the hospital when a patient moves from another center to another, from one center to another center for treatment.
But even though, sir, the small advice if you want to give for a person or a patient who's coming from small town or a village, what kind of advice you give for those set of patients?
So I'd say that first and foremost, you should not agree. You should not ignore any unusual or persistent symptoms. If something feels off, it's always better to get checked early. Even in small towns, no, many primary healthcare providers can do initial blood tests and refer them to the closest specialist. That's very easy thing to do. If you suspect blood cancer or you have been diagnosed. You have to get in touch with a cancer center immediately, because the earlier you go to a cancer center and the earlier you start treatment, the outcomes are going to be very attractive and very supportive for the patient. Because once these blood cancers are sometimes acute leukemias will not give you time at all. Patient will just collapse within days. So it's very important for the treating physician also to refer to the patient immediately if he suspects blood cancer. Let him, even if it is not there, let him be a negative blood test. But if there is a suspicion, always best to reach to the closest specialist and get himself fully evaluated.
Okay, sir, you have talked about treatment, you have talked about diagnosis, everything you are talking so confidently, but still what kind of social impact or the mental support the patient, because cancer is a word which not only affect the individual person, it affects entire family, because you have gone through many looking into your expertise. So how does you counsel those kind of patients who have a or social impact or psychosocial impact, whatever we call it as?
See, blood cancer patients and their families generally face a wide range of emotional and psychological challenge throughout their journey, from the diagnosis till they start treatment. Initially, they feel they fear, they get worried, they become anxious, and first of all, they'll be uncertain about the diagnosis. Most of the patients will be in denial mode. The diagnosis itself will trigger all feelings of disbelief, shock. Especially blood cancers means what our movies and everything shows to us. Blood cancers means is a death sentence. Always when a patient in a movie, if someone is trying to show a hero as blood cancer, at the end they'll try to kill the hero. So that is what blood cancers has given us in a social aspect. But once treatment begins, no patients once treatment begins, also they will have side effect problems and physical appearances, loss of hair. All this is another emotional impact, and there's often a sense of frustration and exhaustion from all these treatments, because these treatments goes for months together. Some even describe that it is a roller coaster ride for me during my cancer treatment, especially if you see blood cancer survivor patients. No? They'll tell them it is a roller coaster ride. It's not going to be that easy. Families also carry a lot of emotional burden, not just emotional burden, financial burden, and they just have to support. Suppose if it is a child, they have to support their emotional aspect, the financial condition of the condition, and also most of these people also develop some social isolation. All these should be addressed, not just the treatment alone. All these patients will definitely need proper counseling, emotional support, financial support, support groups. We have to put them if necessary. And apart from all that, we should make sure that the mental health is very, very important. Not just looking at the blood results, but also the mental health capacity also should be taken care of. It's not going to be easy for when someone is diagnosed with blood cancer. It has a lot of social and psychosocial, psychological impact on the patient as well as the family.
Sir, what is the myth you have generally hear from the patients or normal public about blood cancer?
Myth, generally, no. What I feel is blood cancers are not curable. This is the common myth which I see from the patients. No, that is not like that. Blood cancers are curable. Most of the blood cancers are curable, and certain blood cancers don't even need treatment. There are certain blood cancers which we don't even give treatment, we just observe. So, approaching getting to your diagnosis, getting a clear counseling, and planning your treatment will actually clear most of the myths. And just sitting and looking at the Google is also not going to help. You should take a proper consult such that you are out of these myths, because blood cancer is no more a death sentence. Definitely, we have lots of treatment coming up. As this myth has to come out only when the patient, only then the patient will be able to accept that he can be cured, or he can get back his normal life and go back to his studies, etc.
Sir, I think you have explained my last question also. Last question answer, because breast cancer is curable. Last question was that strong advice. So I feel 50% you already given us, but one strong, powerful advice for the patients, so for blood cancer.
If I have to give a strong, powerful advice, means as I already said, blood cancer is not a death sentence. It is a battle where everyone can win. One thing everyone should be aware is early awareness. Okay, timely diagnosis, and utilize the advances in the treatment which are coming up day by day, such that we can get these patients to cure very easily. Behind every patient, if you see these patients, there will be a story of resilience. They'll come with a story of hope and a strength. All these patients should be interviewed if you get a chance to. They will give a wonderful story about their blood cancer treatment, because together, with the knowledge which is available, with the compassion which we give them, and the determination, all these patients do really, really very well. And every life matters, not just elderly or youngsters. Every life matters, and every fight which the patient has to do will count. So what I suggest is we can all fight this cancer if everyone is strong, smart, and one should never lose hope when it comes to blood cancers.
Okay, sir. Strong, smart, and never lose hope. Okay, sir. Thank you, and thank you for your valuable insights and opinion on this, sir. And you have made us to understand what actually blood cancer is, and you have gone through each and every aspect of blood cancer, like diagnosis, be it treatment, be it accessibility, affordability. Thank you very much, sir, to sharing all these things in our Light It Red Blood Cancer Initiative platform, supported by Natco and also Voice of Healthcare Team, sir. Thank you very much, sir. Thanks for your valuable time. Thank you, sir.
Thanks, Sandeep. Thank you
Thank you,
very
sir.
much.